So everybody, my name is Alex Castaño. If I haven't met you, I hope I do get a chance to meet you soon. I am the Vice President of Marketing at the Naples Chamber of Commerce, or Greater Naples Chamber. And it's my pleasure to have with us Shawna Devlin. She is the president of the Naples Daily News and regional vice president of sales for Local IQ. We have been talking for a while now, right, Shawna, on ways to bring additional value to our members. And one of those ways that always comes up is, how can I reach my consumers, customers, patients in this case, better? And we're all looking for better solutions on that. We're looking for partnerships that can help us. And Local IQ is a great platform, a great media provider, and it's a great marketing tool that you can use to reach consumers, to reach patients. But also, and what's one of the most impressive things about Local IQ for me is their use of data. Well, that data can be mined to get a lot of insights about the market, about trends that are happening in the industry. And that's what today is all about. So we have put together a couple of webinars in different industries to start. And that's what you'll hear today. So before I turn it over to Shawna, I would ask that you please, if you have a chance, take a few minutes as we're getting started with the presentation, and think about those questions that motivated you to join this presentation today. And please share those questions right away, because it'll help guide us through the presentation. It'll also make sure that we address some of those questions that you may have had before. And, because we didn't have them before, we may or may not have included in the presentation. But once you share your questions with us, we will make sure that we address them, okay? So with that, here's Shawna.
Absolutely. And so if you do have any of those things that are just burning topics that you want to make sure that we cover, do drop those in the chat. And then Alex, if you can just flag me as we're moving on. This is your time. And so we want to be sensitive to making sure that we're driving value. Really happy to be with you today on this rainy day. I know that if you're like me and Alex, we touched on this in our last session, there's been, some change of plans. I know that the marketplace was kind of scrambling because camps closed and so forth. So glad that we're recording this to be able to push that information out to anybody that may not have been able to attend, and also just as a good refresher or tool for those of you that are in today's session. So I wanted to just start with the partnership between the Greater Naples Chamber and Local IQ. Its foundation is very strong. I mean, we've been partners for many, many years, and our missions very much align. So we are committed to helping businesses grow and ultimately creating an environment where businesses can thrive. And by doing that really well, it makes the Naples area the best place to live and work. And so as Alex and I we're thinking about, like, how do we increase our partnership, and more importantly, how do we make sure that we are helping businesses understand both the best tactics to be able to invest in from a marketing perspective, but really simplifying the process for them. We thought that these educational sessions would be a good place to be able to return some of that value. One of the questions that I often get is around, our go-to-market strategy connected to Local IQ. So the Naples Daily News is an almost 100-year-old brand. On the journalism side, we continue to use that as our forward-facing brand, and it is very important from a community standpoint for that brand to be strong. A few years ago, we did introduce the Local IQ brand as something that we really umbrella or use when we're talking to clients, because although we certainly see a part of strong marketing campaigns to include what we can offer on our owned and operated platforms, so whether that's naplesnews.com or the Naples Daily News, the truth is that the landscape, and we'll talk a little bit about this, where people are consuming information continues to become more fragmented. We're going more places, we're spending more time digitally, and we really need the IQ, the tech side, the data side that Alex was talking about to help us make some very critical decisions. Because there is so many ways that marketing dollars can be invested. How do we help clients understand what are the best ways for the target audience that they're trying to reach? And so one of the key elements that we want to make sure that we are sharing with you today is both where the opportunity lies and how do we help partner to capitalize on that opportunity. So let's start with the marketing pillars connected to healthcare. So what really drives selection? This category, more than any other category, I think, is influenced by really strong creative. And the message that we're saying to the marketplace matters, right? It is part of the conversion kind of chain. It helps people make decisions. And so we wanted to start here, like, what is driving that? When we look at data that's our own proprietary data, so surveys that we've done in all of our 260 markets, what are the reasons that people are selecting one provider over another provider? So emotional connection, 73% say that this is how they are making decisions within the healthcare arena. They want to feel supported. So beyond just, many things that could really influence emotional connection, it's really around feeling like they're supported by a specific brand. They want local relevance. And so they want to feel like they're known. And a lot of this has to do with nuances. So while there certainly, when we did this pool, there certainly were things that were universal, like the emotional connection and feeling supported. But how we create that emotional connection in Naples is going to be different than how we would create that in LA, right? So there's just geographic changes that we need to be thinking about. And I point this out because there's enough white papers in this space to put you straight to sleep, right? And so we really want to make sure that we're digging beyond just the 3 or 4 things that a lot of those white papers have in common, and really are driving towards things that are going to be valuable, things that you can take back to your team today that are going to help your brand resonate. And then, go ahead, Alex.
So no, and a good example of that, I mean, as we are going through this time with, dealing with COVID, local example is how our local healthcare systems had decided to address concerns around COVID, around masks, and also understanding the balance that our local population is really trying to have between, the procedures, safety procedures that we want to have in place, and also being open. So, there was a lot of communication coming, especially from NCH, that I remember about how important it was for people to know that there were no cases of anybody who was infected at the hospital locally. So, don't be afraid of coming to the hospital, things like that, that you won't necessarily see anywhere else, but build trust locally.
Absolutely. And I think, one of the things that we see within this category that we'll talk about is kind of connected to just that point that, through the last year, our marketplace, at least in pockets, may have been putting off certain service line procedures, right? Everything from having your teeth whitened to, even some ortho treatments where you might have just said, I'm fine, I can put that off, I can wait to have that procedure. And so it does create some backlog, right, too, around like the opportunity and how do we get people who may have been in that category of putting off treatment to now re-engage and make sure that they feel comfortable to go ahead and move that forward. The other thing that that we're seeing is around holistic care. So consumers now more than ever, and I think it is a combination of factors, are engaging around health more than they are around care, right? And what I mean by that is that 70% of consumers are telling us that they want to feel like their provider has long-term health and wellness in mind, right? So if something happens, they certainly want to make sure that there's care to be able to work through that health concern, but they're also willing and interested in investing in holistic wellness to avoid situations that might become more problematic if they were put off.
Yeah. So great example of that too is, for instance, in the healthcare network, emphasis on behavioral health as well as physical health, and and making sure that people who use their service understands that they can come for their entire well-being, not just one symptom or an illness.
Absolutely. And while the some of the creative examples that I've pulled into this presentation, I specifically went and sought out examples that were out of market, just so that I don't accidentally share too much about a strategy that a local company is using. But I do think that we're seeing more and more, lots and lots of local examples of thinking about the whole person. And a great example would be content around alleviating stress, right? We know that stress is kind of the foundation of things that can lead to problems. And so how do we, from a healthcare perspective, really build content and build prevention around just healthy lifestyle, blue zone content, for example? I mean, we're seeing a lot more of that locally at play as well. So the key focus areas on those pillars for health from a marketing perspective really can be whittled down into three things. And mainly, I'm providing this almost as like a check for you, right? So a lens by which you can think through your brand, right? As we're building brands and we're building messages, have we done these things that are really critical to driving conversion within this category? So we want to humanize the brand. So there's a lot of facts and statistics here, but we want to make sure that we know that consumers really see their doctor as the most trusted source for information. We certainly saw an increase in that as we were in COVID-19, and we see the halo of that continue. But honestly, even before we were in COVID-19, this data was really high as far as like a trusted source. A lot of times from a digital perspective, brands are fighting to build trust, right? But in the medical arena, trust is kind of conveyed, right? So a lot of what we have to push against is that we have that trust, but how do we make sure that the brand is accessible and is human, right? And we'll give some examples of how you can do that. 41% are concerned about seeing their doctors in safe environments. And I think that even as we emerge and are on the other side of COVID, that some of the things that people have done as practices, right? Their interest into safety procedures, like those things may stay. Certainly from an access standpoint, all of the increase, and I have some data within the presentation around telehealth is something that has always existed. Well, it hasn't always existed. It existed for a long time, that access to be able to communicate with our medical professionals through the same type of environment that we're using today, but wasn't necessarily something that was used. And as we went through COVID-19, people realized it is easy to engage this way. And so how much of that stays just from an access standpoint as we emerge on the other side of COVID? show local expertise, right? Plugging into the local community and then promoting overall population health. And I think that's what Alex was mentioning with some of the local examples that he referenced. And a lot of this from a brand perspective has been around things like stress reduction or mental health concerns and ways to ensure that we're building resiliency there as we move forward. Alex, do you have anything to add here?
No, I think we're good.
Excellent. So let's talk a little bit about some examples around making the brand feel more human, or humanizing the brand. And I'm using this example, as I mentioned, I went and looked for examples that were outside of just our local area, but I'm using the Mayo Clinic example. And there's two really great call outs here from a messaging perspective. So they initiated, and Alex, I'm not sure if you've seen this, but they initiated a way to really create community. And so the first ad, you can see connect with others who have been there. And when you click on that ad, you enter into an environment that is a community environment where, we know that content is so incredibly important, but the Mayo Clinic, in essence, is the conduit for creating this community where if I am at the start of a journey and Alex is nearing the end of that journey, he can share his experiences with me that really are going to reinforce the things that I'm going to be hearing from my doctor, that are going to create that support network. And the Mayo Clinic then gets a huge brand lift because they are supporting people throughout the journey, but aren't necessarily taking on the heavy lift of needing to build all of that individual content.
Yeah.
Have you seen this, Alex?
I haven't, and I love this campaign because it's behind an insight of the need for connection that we all have, but what also that need for connection does in terms of your loyalty to the healthcare system that you're in, your ability, or not ability, but your willingness to use that healthcare system more often, and to make sure that you use all the resources that are available to you. You are much more likely to use those resources when you have a support network of peers rather than a doctor as an expert that just is kind of preaching to you. I mean, that is important also as a credential. I mean, obviously, Mayo Clinic does not lack in terms of credentials, but in order for Mayo Clinic to attract more people to use the whole gamut of resources that they have, they needed people to connect with other people, other peers, and not just the high tech, specialists.
Absolutely. And what I love about this environment as well is that it has all the things that we just touched on, and then it's built just for what you are describing, Alex. You'll notice you have all of the blog content and then constantly this navigation back to booking an appointment. So if I've read something that Alex has posted on one of these topics, and I think, you know what, it is time for me to make that appointment, that's easy for me to convert into an appointment right from that environment where I'm being supported. The other thing that I wanted to call out that they're able to do both through the message and this portal that they've created is the second ad says it's good to know that you're not alone, right? And so I think that's what Alex was reinforcing around, like, feeling supported. But a lot of times when we think about healthcare, we're kind of on a journey. And so what we see in the data again and again and again is making sure that the brands are reinforcing that every step of the way, you're going to be supported, and you're going to be supported by somebody that you can trust. You get a lot of vouch for and trust on the doctor side, on the credential side, but there are ways for us as leaders in this category to plug people in so that they can get support elsewhere. And it does help that brand then humanize their brand statement, right? Sometimes it's difficult to to have the doctor or the professional always being the one that's creating content, because how they're going to present that is from a very medical standpoint, as opposed to, like, back to the example, how Alex is going to describe his journey is going to be very personal.
Yeah.
Okay, and then the next example here is this locally sourced expert kind of position where a healthcare client is able to really focus on, and we have some great examples of brands doing this locally, and so it's why I specifically went and sought this out. But you can see a couple of different treatments here, and the premise is, like, if we start with this branded content piece, how Salem residents can build resistance during challenging times. And so really focusing on that holistic person and coming to the table with ideas and insights and tips on how we can all take charge of our healthcare journey or our health journey. And then ultimately, again, the brand is the conduit for that. So they are getting this brand lift around being a local source of information within their category by creating content that's really powerful. The other example is 5 simple ways to enjoy outdoors safely as this particular geography reopens, right? And so there are, even on the other side of COVID, there are ways to continue to be that source of information in a way that's very digestible. So, 3 to 5 tips or recommendations to, get out and move, or reduce stress, or find time, right? Because I know we're always kind of, seeking time to get activities built into our day. These are all ways that healthcare providers can be a resource of value that ultimately helps them be the place that people locally are going for insights.
So,
Do you have
Shawna,
something to add, Alex?
well, I just question for you, and it's kind of just to probe into this. What are some ways that a provider can look for content topics, or what are the topics that are going to be most relevant, or find out how do I choose what topics to focus on when I'm creating branded content?
It's a really good question. So for us, we use what the consumers are doing to help inform those content selections. So for example, we're seeing a large increase in self-care searching, right? And so really looking for if the marketplace is searching for a specific thing, how do we package up content that really answers the things that they're looking for right now? So whether that looks like how to meditate on your own, or easy yoga that you can do, or even for me, and I'll like tell on myself, right? I had a big milestone birthday just recently, and so one of the things that I've been looking for is like, am I, using all of the right products for, my skin? Because not everything is major medical. Sometimes medical is elective medical, right? So you can use all of the search increases, what the market wants, to really inform the content decisions that we're making as a brand. Did that answer your question, Alex?
Yeah, thank you very much.
Absolutely. So we know that we want to focus on humanizing the brand, and maybe even look at like ways that we can build community that help us do that. We want to make sure that we're speaking in a very locally relevant voice, and that we want to weigh in on consumer health and wellness in a way that helps build towards that holistic approach. As with every category, we continue to see pretty large shifts in the patient journey. And for us, that means, what are people doing before they make a decision to go with a provider. And some of that is being generated by just increases in the amount of time that we're spending online in general. And some of that is being driven by, the experiences that we've all had over the last year and a half. There's a lot more emotion attached to the consumer journey for healthcare than some other industries. So we primarily can put all of our consumer journeys into 3 buckets. So we've got research and planning, where something normally happens to us that puts us into this research and planning phase. So either I'm having a conversation with Alex and he shares an experience with me that gets me thinking about an experience that I could have in the future or that I'm having now. And so now I'm on my phone, searching for those things. Or something happens in my life that puts me into that research and planning category. But we know that no matter what the driver is or what the trigger is, we often, from a major medical perspective, end up feeling very confused in this particular part of the journey. And the reason why we're engaging so deeply into the research side is because we want to be less confused. We want to know, even before we go to the appointment, we just have a deep desire to know, right? I mean, how many times have you all had an experience? I know that I've had this experience a ton of times where I've done so much research, I almost feel like I'm over here diagnosing myself, which is not great, right? And it's never right. But I'm doing that because I feel like I want to know. I want to move from the confusion part into the knowing part. And then at some point in that journey, we move into engagement, where it's less about all the things, right? And it's more about, okay, I'm gonna focus now. I'm gonna focus on like a source that I really trust or a provider that I really trust. And I'm gonna go deeper into their website. I'm gonna read more of the content. I'm a little less frenzied, right? But what ultimately often happens from an emotional standpoint here is that I start to become a little concerned, maybe even a little afraid, right? And so then I determine that I really need to, make a commitment to making the appointment. And as I make that commitment with making the appointment, I become a little apprehensive, right? So I'm waiting for the appointment and I have some of that anxiety. And the reason that I think it's important for us to think about this consumer journey attached to the emotional journey is that when we understand that and we're thinking about humanizing the brand, there are ways that we can think through our message throughout those cycles, right? Because where people are as they are on this consumer path with you, where they are from a tactic standpoint is different, right? We know that initially when they're confused and they're in the research and planning that they're searching. We know that when they're really engaged, they're probably on your website. So how do we message back to them after they leave the website that helps reduce some of the fear? And then after somebody books an appointment with you, for some of the subcategories of healthcare, there may be a level of apprehension, right? And even if it's more elective and not major medical, there's sometimes still apprehension there. So how are we following up with people to help them understand what they can expect, what your procedures are, reinforcing, your credibility and credentials? That all brings down that level of apprehension.
Yeah, and I would add that as you think about your patients and the specific target groups within your patient population, that there are people that probably spend different amounts of time in each of these stages, that flow from stage to stage in a different way. So some having a higher barrier, to commit to actually going in and being seen, or using the resources that are available to them. And also, there's, and even their ability to do research might vary by, whether it's a different demographic or a different just ability to do that work on their own. Some of them might lean more on you as the healthcare provider. Some of them might lean more on themselves and what they can find on the internet. And then with that, there's a whole range of emotion that is tied to each one of these, stages that someone can find themselves in. And
Yeah,
so understanding that those emotions and that range of emotions will also help you connect with them better.
absolutely, Alex. And, because of the nature of how we're sharing out today, we've needed to stay high level enough to make it relevant for almost every subcategory. But one of the things that we really do, and I think this ties back to some of what Alex was sharing about our brand at the beginning, is that if we knew like a specific subcategory, we could go a step further. We could say, okay, if you feel like you may need to have your knee replaced, the path to decision is much longer, and the emotional triggers are higher, right? And what people are wanting to hear as they're on that digital journey can be slightly different. And we can use that data to really help them feel better about the decision that they're making. And in some cases, reduce the amount of time that it takes them to get to decision. And so while normally, when we think about people who make widgets, right, we talk a lot about like, how long is your sales cycle? And that may seem a bit incongruent when we think about healthcare, but there is a research cycle. And if we stick with the example of having their knees replaced, I'll use my father-in-law. He trained and helped people learn how to jump out of airplanes. So his knees, your knees just do not hold up well when you've jumped out of so many airplanes. And it took him a long time, though, to commit to having the surgery. And that's unfortunate in a lot of ways because his quality of life while he was doing that research was diminished. And so if there was somebody that could have plugged in to that research cycle that he was in and maybe reduced some of the fear or the confusion in that process, got him to a decision sooner, they would have been giving him back years of quality life, right? So I think there's definitely on the healthcare side a way for us to plug in and help.
Absolutely.
So there's a number of things when we think about like creating confidence, because that's also a key component to what we need to do in the healthcare space. We know that as we were in COVID, there was a high percentage of prospective patients that were very, very interested in how organizations were caring for their safety. And so I do think, and the reason why I continue to use this slide is I do think that we're in a time when this is still a question, right? When we're speaking to our clients, there's a wave of people that put off certain things that are, coming back really strong, but there's also a wave of people that maybe still have some apprehension, right? And so we need to continue to think through, even if it's just by having the information on our website really clearly around what policies are going to continue as we move to a different stage connected to COVID, so that everybody is familiar with what those policies are and has the right expectations as they come into your facility. So I had mentioned that telemedicine searches continue to surge. And what's really interesting is that this data continues to be at the forefront of our research. One of the things that we're tracking from a category perspective, even as markets open, and Florida has been open for some time, still from a year-over-year perspective, this is a growth category. And here's why I think that's happening, is that through COVID, a certain population experienced telemedicine maybe for the first time. And then we have all of this word of mouth that comes from that. So maybe I was really comfortable with telemedicine. Maybe I couldn't see my counselor in person, and so I started having counseling sessions through telemedicine. And then I told my friend Alex, And I was like, you're gonna love it. You don't have to, drive. You can still see your person. You're in your space, they're in their space. The session is just as valuable, at least that's what I felt like. And I was able to get time back into my life because I didn't need to drive. And then Alex finally decides, okay, well, maybe I'll look into that. So I think that's why, even though things are open and we could go see people in person, I think this is why we still continue to see increases in the research cycle connected to telemedicine, which is why I think that it's something that we're going to have to solve for. And I know that that puts, in some ways, pressure on the category, right? So when people are expecting to interact with you multiple ways, your website has to be strong, your messaging to get them to the website has to be strong, your in-person experience has to be strong. And now potentially we're talking about, like, we need to have an ongoing path for really strong delivery virtually, as some people just start to prefer that for some of the services that they are going to receive under the healthcare umbrella. So when we look at all of the data, right, the takeaway as I look into my crystal ball, right, around what does the next 12 months look like for healthcare, I think it's very service line specific. We know, and this is where the data is coming from, that while services continued, right, through most of the pandemic, there was a chunk of people that put off care for themselves or care for somebody else in their household until they get to the point where they feel comfortable. And that means that there's a backlog, right? And that creates an environment where you end up with an enormous amount of searching at the service line level, right? So normally when we think about, especially like specialty services, a lot of times that's, your general doctor saying like, hey, you may want to look at this, right? There's a trickle of referral business. Well, now we have that continuing as well as this backlog. And so we need to make sure that when people are specifically searching for service lines that you offer, that they can find not only you as an option, but also like what sets you apart. So a lot of our conversations right now that used to be very brand heavy are much more like, let's talk about the individual products and services that you offer and building micro campaigns for each of those, because we know that there's pent up demand here. Mm-hmm. We also want to make sure when we start segmenting the business down like that, that we are aligning the message that we're saying to folks to the landing page where we are sending them, right? So the lift around segmenting out brand messages is not just, hey, here is why we are a brand that does 3 or 4 or 5 things, but here is why we are an expert in this service. When we send somebody to the landing page from that creative or from that branded content, it needs to be something that's seamless, right? So I need to go right into the landing page where I get a little bit more information about the product or service that I have clicked on that landed me there. And then similarly to what we were discussing a few minutes ago, the opportunity for that prospective patient to convert right away. When we don't do this well, what ends up happening is that your messaging is strong, it's doing all the right things. We actually get people to the website and then they don't convert. And that is an incredibly expensive position to be in. So we want to make sure that we're solving for that. Anything to add there, Alex?
So Shawna, just to understand the slide here, what we have on the left, the standard messaging, when does that come, or when do people come across that? And then when do they come across the landing page opportunity?
So good question. So it's a general position around making sure that we correlate. But in this specific example, this is a piece of branded content, right? So somebody was like really educating about a certain service that they offer. And then when you click on that ad unit, when you click off that page, they're directing them right to in this example, the opportunity to set up the virtual visit, to learn more. They've given a little bit more information, or like a quick call out around like the credentials of who you're going to see, and then the conversion into requesting the virtual visit. But it aligns, like this landing page that's all about driving conversion aligns to kind of the longer form ad unit in the way of content, so that we can pick up, in essence, leads, right, or appointments from that marketing.
And it's really interesting because if you follow what would be the patient journey and what we were talking about earlier about specific product lines or service lines, is that somebody with an issue with their knee will be searching for information about potential injuries they may be experiencing, potential symptoms that they may be experiencing. They're doing research about what they're feeling, not necessarily who the best provider is, or not necessarily who's nearby. That might be also part of the journey. But at this time, what we're saying here is like they may be looking to learn more about what's happening with their knee. Then you have an opportunity to provide very relevant advertisement, but very specific too, because this landing page doesn't. So if you have an ad in where it says standard messaging, you're not going to take them to the homepage of NCH, for example, or you're not going to take them to the homepage of Lee or Healthcare Network or any of the providers that you represent. You're going to take them to a place where they can feel like they're going farther down that funnel, and they're getting more information that they were looking for to begin with. But now it's relevant and now it's specific. So Dr. Jonathan, I think Godin is the example here, is going to feel, and the fact is board certified, orthopedic surgeon, and he can reach you to come from your home, is going to feel like you're providing value while you're also providing, connecting through an advertisement.
Yeah, I absolutely agree. And I think that, what that landing page looks like whether it's more information or like this, at this point, if you are reading and engaging with this ad unit that's long form written content about knees and knee injuries and how we fix that, then what comes next, you're so far down the funnel. What comes next is booking the appointment. But if you were more like higher funnel, like, oh, my knee is hurting, and you had content about that, then you might actually send somebody to a page that has more blog content about like what that could mean. So this is a very low funnel example.
Mm-hmm.
So what this means for you, we want to make sure that you're always in a position to educate and inform consumers. I think that the last example and Alex's additional details there really reinforce that. And then, as always, we need to have continuous outreach around those service lines, and everything that you have from telemedicine upgrades or new services, as well as anything that you're doing on the safety situation as an ongoing matter. So in essence, what we've been speaking to is making sure that the consumer is really at the center of the marketing plan. So we want to make sure that the brand is there for the consumers no matter what, because that's what they say that they want, right? So going kind of full circle back to what makes people decide to pick a certain provider. We know that that security and a lot of that has to do with like safety and trust is paramount, as well as confidence. And then connected to that, from a outcome perspective, they're looking for quality care, right? Things that this group of people know, because this is the lane that you swim in, and quality outcomes. And so what's really interesting, and Alex and I have done this work connected to so many categories, is that when we look at survey information around what people care about, what types of messages will make them feel like that their concerns are being answered, the data is pretty clear and pretty specific. And yet when we look at ad creative that's being generated, and it's not just healthcare, it's almost any industry, there's a disconnect between the things that drive consumer action and the things that we say in messages, right? So from an efficiency of the buy perspective, no matter if you're doing your marketing on your own or you're partnering with marketing, one of the things that's really important is, I think, looking for that connective tissue between the two. Content in this category is obviously a big driver, right? We've been driving at that. We've been talking about that. Even the message around knee replacement is a great example of that. And so Alex asked a really great question around, like, how do we determine what types of content we should be focused on? And certainly search is a big player. What are people actively looking for? I think that the other thing that we look at is what has worked in a specific geography, in a specific subcategory prior, and does the search patterns today really correlate with that? So in the last year, we've produced 546 specific content pieces related to the healthcare industry. We have 260 newsrooms that are producing their own content that we have analytics on, right? So we're able to track back to that. And then we are getting responses to all of that content that's being generated. And that really informs those two things together: our own first party data, which this is an example of, and then the access to data that we have from other media industry leaders like Google helps us decide what really is going to play best for that individual audience. And here are some of those best practices. So again, like, you can take this today and use this in your content strategy. You can use it to create blog content that's really going to help drive your placement and also inform some of just the standard ad units that you have. So we want to make sure that we're building trust and that we're telling stories from a patient's perspective. And so this goes full circle back to the Mayo example. So whether you're creating the environment where patients can tell their own stories, or you're taking their stories and building those into your own media campaign, these are some examples. So we have, a story here around a survivor of COVID-19, right? And what their experience has been. But in any subcategory connected to medical, you have patient stories around how what you are doing impacts, like, that particular target audience, or what their results were. So back to what the survey information is saying, that quality outcomes really matter in picking providers. So how do we reinforce that you as a provider are providing quality outcomes? We tell patient stories, right? And so even if, and I know for some categories and subcategories, like getting patients to say, I had this procedure and this is my outcome, is not an easy thing to do. And so even just creating personas where we may not be using a specific example, but we are saying, like, hey, if you are experiencing these things, we've had 260 people that we've seen, and 95% of them no longer have, like, these symptoms or those challenges, right? So just collecting enough anonymized data for you to be able to tell an outcome story is important.
Yeah, this provides a certain level of credentialing as well. And we've talked about that when credentialing is needed from not just the experts, but also peers. And so it helps you connect and relate to patients, consumers, at their, by the fact that they're connecting to other patients.
Yeah, absolutely. And then one of the things that I think had like a halo effect coming through COVID-19 is we have had these healthcare hero moments. And interestingly, as you mentioned, credentialing, because I think that what we have seen from that is not only does it increase appreciation from the general community for people that are in this category doing really phenomenal work, but it allows us to tell a story about, hey, if you come to this practice, you might have the opportunity to have Alex be your healthcare partner. And this is how Alex, approaches the business and what his background is. And this is why he is in the business. So it allows us to humanize the brand, to tell a story about somebody that is associated with the brand and help set expectations. And even if I don't see Alex as a new patient, what I am going to understand is what is the culture of the environment that I'm going to be walking into. And so I think that from a consumer behavior perspective, and this is where I pulled some of this data, like whether we call it COVID fatigue or quarantine fatigue or whatever type of fatigue that we are calling it, I think that the end result of where we are right now is a extreme focus on self-care activities. And so I've pulled in just some stats here around how search is increasing from a year-over-year perspective within these categories. So how to meditate, or what can I do for myself that's within self-care, so self-care activities, self-care ideas, can I plug into yoga? And so I just think that right now, if I were thinking about a healthcare brand and content, I would be really evaluating whether or not there was an association that I can draw with being a local expert or creating community or being a conduit for information that helped people understand how to care for themselves and ultimately how my products or services might align with that. And then, we've talked a good deal about how medical professionals have an enormous amount of trust, and they have that trust by their credential and because of the associations that we feel there. And from a news standpoint, we have some of that as well. And so I do think that as you're thinking about your content strategy, if you're wanting to push content beyond just your own website, it's important to think about where is that environment, where are you going to have that content live, so that you're already really high trust factor of the medical professional is really aided by the environment that you're placing those ads. I think in healthcare, probably more than any other industry, the environment where you're running the ads really matters, right? You want to make sure that it's always something that's incredibly brand safe. Did you have something to add, Alex?
No, I think brand safety is really important, but that's why you got to make sure that you're partnering with the right provider to ensure your content is in the right space. On the part about if you go 2 slides back for a second. So 1, 2, yeah. On this is a great point to also think about. This is that you are not always able to be connected as often as you want to with your patients, right? Because your services are limited, maybe because doctor's appointments are way far out, things like that. So these topics also provide an opportunity for you to stay connected while it's time for the next appointment or for what it's time to the next checkup, instead of just waiting to only talk and connect with someone once a year when they go in for their checkup. You can use these topics and create new service lines that provide kind of a DIY, method of them to connect with you.
Absolutely. And you get the brand lift of, again, being that expert or being that community conduit to wellness, which we know is a key focus. So when we think about self-care, and this is a nice lead in, there are driving factors, right? So I want to reduce stress. I want to make sure that, you know, my mental health is on strong footing. And then there are barriers to us investing in that. And so we're breaking out the data here, and I want to be sensitive to time, so I won't spend a lot of time here, but we are going to send you this information. And I think as you're building those content ideas, it's also important to think like, why would somebody not do this? And can I provide tips on how they can overcome those things that are barriers? Your target audience is very specific. And once you build out your content strategy, whether it's on your website or it's through a partner, it's really important to think through, how are we going to target the right people to those areas where the content is living, to make sure that it's giving you the brand lift that you're really wanting and expecting. And so similarly, we've taken a look at, you know, locally, like what are those lifestyle stages, because connected to healthcare, it really does tend to be what stage of life are you in, and then what are the things that are the top drivers. And so you really can start thinking about like, all right, if I build something around stress reduction, that actually plays for all of my target audiences. If I build something around mental health, like, does that play for all of my target audiences as well? And if budget becomes a concern because you can't reach all of these folks, if you've built like a specific content strategy for stress reduction, maybe you don't include wellness warriors because it's not number one where it's number one for everybody else. So a couple of things that you'll be getting from us as we wrap up our time together is that we do have what we call a grader report. And what that helps businesses understand is that from a digital presence perspective, are you taking advantage of all of the tactics? Are you in all the right places to be able to drive your business forward? It also allows you to see, like, how does your brand stack against your competitors? And so we will be ensuring that you get a copy of your own individual grader report. Additionally, you'll receive an email with this presentation, as well as a workbook that helps you think through, like, what are some questions you should be asking yourself around humanizing your brand, right? How do you build out some of these target audiences based on your own path to decision making that makes sense for the subcategory that you're in? Our whole goal here is that while we've been speaking at a pretty high level this morning, that we're really giving you some very tactical, some very specific tools that helps you make this live within your own organizations. And then ultimately, we'd really love your feedback. So this is one of the first sessions that Alex and I have done around this outreach to make sure that we are providing as much information to the marketplace as possible so that business leaders can really grow their business and the community can thrive. So if you have any feedback with us, we'd really love to hear that. And then lastly, as we're going to send this presentation out, I wanted to make sure that you had the contact information for Alexa, who was a teammate of mine, as well as Alex, who's leading this initiative at the Chamber. So if you have any questions, please reach out. We want to make sure that we get those questions answered for you as quickly as possible. And I just so appreciate that you've spent this time with us. Alex, is there anything that you'd like to add as we finish out our time together?
Yes, thank you very much, Shawna and Alexa, for all the work and all the knowledge that you've been able to share with us. I know there's a ton more where that came from, and so I'm excited to see our members at the Chamber take advantage of that opportunity. If for all of those who are on this webinar, if you want to share this presentation, please feel free. We'll send all the details out to you and everybody who registered. And again, this is an opportunity that is brought to you because of this partnership with Local IQ and Naples Daily News. So thank you very much, Shawna, for that partnership. And thanks everybody for coming.
Absolutely, my pleasure. Have a good day, everybody.